Yeah, welcome everybody, everyone to for today's QAFI seminar, and it's about empowering Indigenous communities to improve their health through nutrition. Introduction of a low sugar carbonated beverage, a really interesting topic. And Jess, have a few words later on, are the presenter today. The next slide, Jess. Yeah, my name is, maybe most of us, of you maybe already, know me. My name is Michael Netzel. I'm a Senior Research Fellow at the Center for Nutrition and Food Sciences at QAFI, and today's facilitator. So the next one, Jess. The photo is a bit old, to be honest, but yeah, a few more gray hairs, unfortunately. So before we start, I want to do the acknowledgement of country. The University of Queensland acknowledges the traditional owners and the custodianship of the lands on which we meet. We pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country. We recognize their valuable contributions to Australian and global society. The next slide, Jess, please. Yeah, the usual housekeeping things or introductions. So the seminar will go from 12 to 1. I guess Jess maybe will finish maybe 10 to 1, depending, and then we have at the end Q&A session. And please use the Q&A button. Again, we always have to say this and mention this because it's still and not the chat function. Still a lot of from the audience using the chat button. So please, the Q&A, and I will then read the questions and to Jess, and then she will try to answer your questions. Yeah, I think what I already mentioned, Jess or Jessica Cartwright, I'm not sure if you already met her, is our seminar presenter today. Jess is a PhD candidate at the School of Human Movement and Nutrition Sciences and working with the IRC Center for Uniquely Australian Foods. She has completed her undergraduate bachelor's degree in exercise and nutrition science and also holds a master degree of Dietetics Studies. She has received academic awards for every semester of her studies, holds a UQ Employability Award, and was awarded the Dietitians Australia Highly Commended Student Prize. Outside of the university, Jess also works as a dietitian at a medical practice and as a nutrition assistant at a hospital. So really would say fully focused on nutrition, exercise, healthy nutrition, health. So Jess, yeah, I think it's your turn now. So I will mute and turn off the camera. And yeah, we'll see us again at the end when we have the Q&A session. Thanks.
Thanks, Michael. I hope everyone can hear me okay. So yeah, as Michael said, my PhD project is called Empowering Indigenous Communities to Improve Their Health Through Nutrition, Introduction of a Low Sugar Carbonated Beverage. And before I get started, I too would like to acknowledge the traditional owners and their custodianship of the lands on which we meet today and pay my respects to their ancestors and descendants. So, yeah, first things first, sugar sweetened beverages, what are they? Essentially, it is any beverage that is sweetened with sugar. So we're talking things like soft drinks, cordials, like iced teas, energy drinks, sports drinks, etc. And what we know about sugar sweetened beverage consumption in Indigenous communities is that it is pretty consistently always higher than non-Indigenous communities. And that's seen nationally within Australia, but also on an international scale as well. So we know that, nationally, a quarter of Aboriginal children aged 6 to 12 months have been exposed to or consumed some form of sugar sweetened beverage. Aboriginal and Torres Strait Islander people consume 15 grams more free sugars per day than non-Indigenous people. And so free sugars are those essentially added sugars. So not really any nutritional value, empty calories. And yeah, Aboriginal and Torres Strait Islander people derived a higher proportion of free sugars from beverages than non-Indigenous people. So 67% compared to 51%. That's within Australia. On a global scale, 75% of beverages consumed by native Alaskan children were some form of sugar-sweetened beverage. Approximately 4 in 5 African-American people consume sugar-sweetened beverages, and Alaskan Natives, African-Americans, and American Indian children consume approximately 300 calories per day of sugar-sweetened beverages. And so that contributes almost 20% to their recommended total daily energy intake. So yeah, that's equivalent of 5 Weet-Bix worth of soft drinks and stuff per day, which is, yeah, a fair bit. So essentially, we know sugar-sweetened beverage consumption is higher in Indigenous populations. What we also know is that there's strong associations between excessive sugar-sweetened beverage consumption and adverse health outcomes. So there's been literature reviews on literature reviews documenting that having too much soft drink can lead to, or strongly associated with type 2 diabetes, obesity, cardiovascular disease, high blood pressure, dyslipidemia, so things like high cholesterol as well. And there's weaker associations there with things like low calcium levels, decreased bone mineral density, and dental caries too. So we know that sugar-sweetened beverage consumption is high in Indigenous communities, and we know that that's associated with poor health outcomes. So where does this project fit into it? Essentially, our overarching aim is to combine traditional knowledge, nutrition, and food science to develop a beverage that will improve health outcomes and empower remote Indigenous communities to improve their health. So talking about specific objectives, we want to learn why sugar-sweetened beverage consumption is higher in Indigenous communities than it is for non-Indigenous counterparts, then develop a sort of alternative low-sugar sweetened beverage using native ingredients, discover the nutritional composition of this low-sugar drink, and compare it to that of a regular soft drink. Travel to Indigenous communities and get their insight, input, feedback on our drink as well, and then investigate the impact that this drink has on the human body. So if it means that it results in a lower blood sugar reading than a full sugar soft drink, that would be useful to know. Whether or not this falls inside the scope of my PhD, not sure, but hopefully we'll get to explore that after nonetheless. In terms of, hypothesis, I'll just orientate you around this little mini framework here. So we'll start with increased soft drink consumption. We know that that leads to poor nutrition and poor diet quality. And we know that poor nutrition accounts for 20% of the increased chronic disease prevalence within Indigenous communities. And we know that chronic disease accounts for 2/3 of the health gap that exists between Indigenous and non-Indigenous people. And that widened health gap can oftentimes lead to disempowerment as well. And, feeling a sense of hopelessness or that they have no control over their health. And then that can further perpetuate this cycle, which we don't want to happen. Also just wanting to acknowledge that, obviously there's many other factors that influence each part of the cycle. It's just a very simplified and condensed version of it. So hypothesis then, we hypothesize that by decreasing sugar consumed in the form of beverages, it will inversely influence that framework, meaning First Nations people will have improved nutritional status, decreased chronic disease prevalence, and a greater sense of empowerment. So that's the plan. In terms of our proposed strategy, as I've kind of mentioned, a reduced sugar soft drink using native ingredients. So how are we making that? Essentially, we'll start with the Kakadu plum. You can see here on the right-hand side. That becomes the puree. Again, you can see that there on the right-hand side. And then that undergoes a filtration and carbonation process. And then voila, you have the final beverage. So this is just a little photo shoot I did with it. These are some samples that we were trying. The yellow variety is just with the Kakadu plum, and the pink variety has Davidson plum added in it as well. I won't spend too much time on methodology, but just touching on some of the approaches that are underpinning this research. design thinking. So obviously we're co-creating, co-designing a product. So we need to be, thinking about that, thinking of who the end user is going to be, implementation, all of that sort of stuff we need to have in the back of our mind. Strengths-based, so harnessing traditional wisdom and resilience and using their native foods and incorporating all of those elements to help us kind of create this drink and undertake this research project. Focusing on the strengths rather than any deficits. Co-design, so we have at Uniquely Australian Foods, we have an Indigenous advisory committee, we have Indigenous partners. We've just done taste testing with a subset of Indigenous populations. So getting their feedback and making Indigenous people as involved in this process as possible. I myself am a non-Indigenous researcher, and so that ensures that the drink is still designed in a culturally appropriate manner. And then action research, so essentially acknowledging that the first sort of half of my PhD will largely dictate the second half of it. We're just taking it one step at a time. Any results or findings might alter the trajectory of what the next year or two looks like. And we need to be okay and understand that. So that's touched on the methodology there. And I just wanted to also just touch on this image. I came across this when I was preparing for my confirmation. It's an Indigenous painting by an Indigenous person. It's called The Dance of Life. Essentially, it is representing Indigenous health from an Indigenous person's perspective. And I think that it's a stark difference to the Western perception of health. So which is perceived as very biomedical, very physical based, and not really much consideration of anything else, quite compartmentalized from, your environment and everything else. Whereas this painting essentially shows that when you're looking at health from an Indigenous perspective and what that looks like, it considers physical, psychological, social, spiritual, and cultural, and all of those things kind of make up what good health looks like, which is, I think part of why there has been some sort of limited success in the area with trying to improve Indigenous health from a Western perspective. And I guess shows the importance of needing to really empathize and try and see the situation from, their point of view. So most of last year, I was working on a literature review. Essentially, what was that about? We know that in dietetics, we always have a root cause that leads to an action or a behavior that has an affiliated consequence with it. And so in this situation, we know that high sugars and sweetened beverage consumption is the action, and we know that that can lead to increased chronic disease, a widened health gap, etc. What we don't really know is the cause of that. And so that leads us to our research question, which was, what factors influence sugar sweetened beverage consumption in remote Indigenous communities? And that's what we were trying to find the answer for in our literature review. So the research approach, we did a systematic scoping review, and we used the Confidence database to help us with that, following the PRISMA guidelines as closely as we obviously can. So we used 5 databases that gave us over 2,500 articles to start with. We also saw value in searching the grey literature as well, because it's a new-ish sort of area in the research as well. So going through the process of title abstract screening, full text review, applying exclusion criteria, we ended up with 34 papers included in our review. Results. So we ended up with 8 quantitative studies, 19 qualitative studies, and 7 mixed methods studies. And in all of those, there were 37 factors influencing soft drink consumption that were identified. As you can see in this graph, taste preferences was the most common. And as you can see in this table, all different levels influence soft drink consumption. So just talking a bit more about this graph here, obviously along here are the top 15 factors influencing soft drink consumption. And this is, how many papers they were mentioned in. So taste preferences coming in at number 1. obviously they like the taste of it. That's why they drink it. That's the biggest draw card for the high soft drink consumption. Coming second is community availability. So in convenience stores, canteens, tuck shops, you know, like, yeah, little outback stores, the markets, etc. Soft drink consumption, soft drink availability is, yeah, everywhere. It's very omnipresent in remote communities. Health literacy, another one, so that, yeah, like nutrition education and knowing what's healthy versus unhealthy. One quote that I remember reading that's resonated with me is in a paper, it was an Indigenous lady, and she was saying like, oh yeah, I don't drink Coke anymore. I know that's bad for you. I drink Fanta or Sprite or something because it's healthy. So that is definitely still a consideration that needs to be kept in mind. Other things that came up as well were like water quality, for example. So yeah, often they have limited or no access to safe drinking water. And so, yeah, I remember when I was doing reading all of this, oftentimes they associate soft drinks as being healthier because it's safe to drink, which was interesting. Yeah, weather was another one. So in outback Australia, it's very hot, and yeah, having like a refreshing carbonated beverage was, yeah, really nice for them to have. So that was also mentioned too. Some other factors that were mentioned 1 or 2 times were things like presence of others. So kids, for example, when they're with their friends, they're more likely to opt for the sports, like, you know, Gatorade, soft drinks, etc. Whereas if they're parents, they're more likely to opt for healthier alternatives. Yeah, and affordability was another interesting one as well, actually. In community, soft drink is actually cheaper than water in a few different communities, and it's often cheaper than the diet varieties as well, which is another consideration. So implications, where to next? What does this all mean? Looking at this little graph here, the ones with the green dot are essentially ones that we have identified to have an intervention in place already for them. So what's interesting is there's, yeah, taste preferences kind of hasn't really been targeted in the past to our knowledge. So yeah, as I said, there's been past interventions done on availability. So removing the top 3 selling beverages, health literacy, so nutrition education programs in schools and communities, affordability, so applying like a 10%, 20% price decrease to the full sugar soft drinks, water quality, introducing bubblers and taps with safe access to water in schools and communities, advertising policies. All of these have kind of been tried and tested in the past, and quite limited success overall. And so kind of begs the question of why taste preferences hasn't really been considered before, and perhaps suggests that that could be the direction for future research, which actually really aligns quite nicely with where our project fits in, because it is acknowledging the fact that, yeah, they're drinking soft drink because they like the taste of it. So let's create a healthier version of a soft drink for them. That leads us to our sensory trial, talking about taste testing. So essentially the rationale for doing the sensory trial was to identify how much participants like the beverage, and the different varieties we're playing around with, trying to find a favorite drink, to measure sweet liker status. I'll talk more about that in a moment. And then to kind of link their sweet liker status with their beverage preferences, with their demographic information, and see how that kind of all fits in together. So we collected data at TropAg. We collected data when we've had some Indigenous people coming to our labs at Elkhorn and visiting. And yeah, this graph over here on the left-hand side, I'll just orientate you around it. So on the x-axis, we have increasing sugar concentration. And on the y-axis, we have a liking rating or acceptability rating. So what has been found in the literature so far is that as sugar concentration increases, we have this group of sweet likers where, yeah, as concentration increases, their acceptance for it increases. Sweet dislikers, where as the concentration increases, their acceptance decreases. neutral. So no matter what the sugar concentration, their acceptance remains the same. And then an inverted, U-shaped curve. So they like it up until a certain point, and then it becomes too sweet and they don't like it. So that is, what we were using to try and cluster groups of participants, and then see if there's, any associations between that and beverage preferences and, all of the other things I just mentioned before. In terms of developing the samples and deciding what samples we're going to include, we decided to include a no sugar commercialized soft drink as an anchor on one end, and then a full sugar commercialized soft drink on the other end as an anchor. And so the no sugar one was no additives or anything either. It was just infused with fruit flavors. And then we have our 3 ones, which is kind of in the middle, I guess. And so that was based on this, which was done by, I think, Harvard. And it just shows the amount of sugar in different sort of beverages there. The red ones are the ones that you should drink sparingly. The yellow ones are a better choice, and the green ones is the best choice ones. So our approach was, okay, let's have one in the red category, one in the yellow category, and one in the green category, and see which one is the favorite. The reason why we're interested in this category here is because there's not much that exists on the market that's low sugar. It's either high in sugar or it's no sugar. So this is a bit of a gap in the market that we could maybe enter in that gap there. So essentially we have our high sugar sample, which is still 47% the sugar content of a Coke or a full sugar soft drink. I think it comes in around here. And that's our 20 grams per 340 grams. That's our high sugar sample. Then we have a yellow one. So that's our medium sugar sample. Fits in around here, and that's 24% of the sugar content in a cola. And then we have a green one, which is 5 grams per 340 grams, and that's 12% the sugar content of a cola. So very, very low. The reason that we wanted to have one of each is because we think that it would be smarter to include one of each of those, because we don't want to run the risk of just going, we'll put this one into the community because it's the lowest in sugar and that'll be good, and then do the taste test, figure out everyone doesn't like it and they reject it completely. We don't want that to happen. So if we do need to start with a slightly higher sugar sample and then slowly wean down over time, then that's the approach that we would rather take. In terms of preliminary findings, I'm still kind of sifting through all of the data from this, but essentially over 10 participants identified, I think it was closer to 20 actually, identified as Indigenous, 70% female, age range from 18 to 90 years old. This here just shows the overall acceptability. So coming in last place is the no sugar soft drink. I know it says low there, but it should be no sugar. So this was just the one infused with fruits, the commercialized one. These were our 3. So this was the green, the yellow, and the red one. And then this was the full sugar commercialized soft drink. So essentially, as sugar concentration increases, beverage acceptability increases, which is interesting because sweet liquor acceptability, as the sugar concentration increases, the overall acceptability decreases. So obviously I need to still kind of go in and explore that a lot more and kind of, group it as children's versus adults and Indigenous versus non-Indigenous, and try and, explore and justify the results as well. So I've got a lot more to do here. This is just some general feedback. We had a other comment section. So 182, I like when people were saying that was the favorite one, because that's this one, our 20 gram one. So it's been useful going through all that too, but still a lot to do in terms of thinking about results and implications of this. Lab analysis. I would just like to preface this by saying that I have learned a lot being in the lab, and I have heavily relied on the help of Suki and Ann and Adiamo, helping me kind of go through all of the tests. So I apologize if there's any questions or if some things maybe don't make sense, but I'm still in the process of trying to understand all of this. So bear with me. vitamin C was one of the things we tested using the HPLC method. Why were we interested in vitamin C? Because we know that Kakadu plum has a vitamin C content of more than 100 times or 100 times-ish that of an orange. And we know that Kakadu plum is obviously the base ingredient of this beverage. Other questions that we were thinking is, how much is too much? Is, what happens if there's way too much vitamin C and we need to kind of draw it back? Is that something we need to be worried about? Can we make a nutrient claim for this vitamin? And how much vitamin C is lost during the beverage production? In terms of results and implications, so keeping in mind the recommended dietary intake, the RDI for vitamin C is 45 milligrams per day. To achieve this recommendation, a consumer would need to drink 130 ml of this beverage, which is nice to know, because if we're particularly working with remote Indigenous communities, access to fresh fruit and veg can be difficult and limited. So if we can use this as a way to ensure that they're still getting meeting their vitamin C requirement, then that's really promising. It's comparable to a commercialized orange juice, which is also kind of fun, which contains 10 to 50 milligrams of vitamin C per 100 grams, and our beverage contains 34 milligrams of vitamin C per 100 ml. So fits within that range nicely. Obviously, compared to a regular soft drink, you wouldn't expect any vitamin C to be in a regular soft drink, so that's a huge bonus that this drink has. Antioxidants, so we did TPC on this one, and rationale. We know that oxidative stress is caused by the accumulation and action of free radicals, otherwise known as ROS, reactive oxygen species. And we know that these free radicals can cause damage to tissues and cells, which is linked to development of chronic diseases. The literature kind of, is saying that, due to past and present day stress and trauma experienced by Indigenous people, Indigenous people are actually shown to have higher levels of oxidative stress than non-Indigenous people, which therefore increases their risk of developing chronic diseases. So that might be playing a part in it as well. So comparing our results to, again, like a commercial ready-to-drink sort of orange juice, our beverage has 34 gallic acid equivalent, and the ready-to-drink orange juice has somewhere between 18.7 to 54. So again, it fits nicely within that range there, and is comparable to an orange juice. Again, compared to a soft drink, you wouldn't expect much there at all. So another huge bonus of this drink compared to a regular soft drink. And fiber analysis. So rationale, why were we interested in fiber? We know that that's obviously important for digestive health, regular bowel movements, helping us feel full, and can assist in improving and preventing some chronic diseases like high cholesterol, type 2 diabetes. And the recommendation is 25 grams per day for females and 30 grams per day for males. A literature review found that 77% of Aboriginal and Torres Strait Islander people aren't meeting that recommendation, with an average intake of about 18 grams per day. Also keeping in mind that the flesh of the fruit is often a good source of soluble fiber, and we know that that's one of the main components used to create this drink. So it got us thinking if there was, much fiber in our beverage. We did fiber analysis. Turns out there's not really too much, which is, still good to know. Less than 0.1%. So comparing to 1 glass of orange juice with pulp, 1.25 grams, 1 glass of our beverage, 0.2 grams, soft drink, 0. Keeping in mind that the pulp would probably be insoluble fiber, which would be contributing to maybe why that's a bit higher. Again, I've still got to do a bit more work in terms of, discussing implementations and kind of wrapping my head around these results properly as well. So that's lab analysis. And then community engagement is obviously an important part as well. So at the end of last year, we got to go to Alice Springs and meet with some organizations there and try and foster some relationships, and hopefully we'll get a chance to go back there at the end of this year. We went to Purple House, which is a dialysis unit that's there. And we had some of the patients that were staying there, we had some of them try the drink, and yeah, they all loved it. We also met with Children's Ground. That's us in a meeting with them there. And we also got to do a little bit of sightseeing, which is nice. So yeah, we've been really trying to nurture these relationships that we formed when we went over there since then. And yeah, we're hoping to return as soon as possible, and do some more sort of focus group testing. We didn't collect any data when we went there for that visit, so it would be nice to go back and see if we can get their thoughts on the drink and do some more testing in that regard as well, which they're really looking forward to doing too. So that was Alice Springs. And recently we also had the some elders from Kintore, which is a remote Indigenous community. We had them come and visit our lab recently too, through one of our other PhD students at Uniquely Australian Foods, Tatiana. So this is a photo of us all. That's Mimala, that's her name, that's Marley, that's Lorna, and that's Umpy. She's one of the elders. So it was lovely having them and showing them around the labs and trying different foods with them in the kitchen and whatnot. It was an awesome week with them. There's a photo of Yasmina with Marley making some wattle seed, we had wattle seed damper, which was awesome. This is Lorna showing us her artwork that she made. And this is a photo of me, in the lab. They all tried some of the drink as well, which was a great opportunity. And if you listen closely, this is what Umpy, the elder, this is her feedback of the drinks. You need to listen a bit closely, there's some background noise, but I'll just play it now. So that's nice feedback to have. But yeah, it was a really lovely visit. And yeah, hopefully again, I can go to their community and they want to show me how to make damper. I can bring some of my drinks. So yeah, I'm really looking forward to, if we get an opportunity to go there within the next year or so of my PhD, that'll be great. In terms of next steps, where to from here, needing to bring some drink to community and do some taste testing with them out there. We're hoping to do some sort of yarning circles with some kids and also adults from different remote communities around Australia if we are able to get there. And we're also going to do a paper on ethical and legal considerations for commercialization of First Nations food products. So considering things like benefit sharing and making sure that the Indigenous ownership is recognised and acknowledged and appreciated. I'll be doing that with Kamalesh from the law school, which should be exciting too. Plan for the fibre component of the drink. So obviously we're just using the liquid sort of supernatant part of it, but we're kind of accumulating the sediment part of it, like the pulpy bit. And so, deciding on something to do with that could be fun. I know, maybe like a muesli bar or something. Again, that's maybe outside of my PhD. And then, more long-term, forming relationships with manufacturers and other sort of places. Again, thinking more about that implementation and, what's going to happen with this project once my PhD ends, and make sure we can still kind of lift it off the ground and get it going. So that's July and beyond. Acknowledgements, I'd just like to acknowledge my research team and my supervisors, the other staff at Coffee that have all been really helpful in everything that I've done so far, our Indigenous partners, the institutions that this research is affiliated with. That's my references, and that's the end. Thank you very much for listening, and thanks for having me on today as well. I'll leave it there.
Yeah, Jess, thanks very much for this really comprehensive and excellent presentation about, your PhDs and how complex, your work is. And I think we have a couple of questions in the Q&A. Let me see. First question from Daniel Rodriguez. Why the drink needs to be carbonated, particularly when it is well known that carbonated beverages contain acids that will cause teeth decay? Do you have a dentist in your co-design panel?
Yeah, it's a good question. This is actually something that we spoke about at my confirmation. Largely the reason we've decided to opt for carbonated at the moment is because I think based on discussions with the Indigenous Advisory Committee, that was what they were wanting. Obviously, when we're talking about implementation and we're working with specific communities, if they prefer to have it as like a cordial sort of syrup thing, yeah, that's like, we're definitely open to having that. It's just more so based around whatever the community wants. I think the initial reasoning behind it was because having the carbonation can make it more refreshing. And so, yeah, thinking about remote Indigenous communities where it's really hot, like grossly hot sometimes, I think that was part of the initial reasoning behind it. But by all means, it's probably easier if it's not carbonated, but we're just going to be led by what the communities want in that regard. I hope that answers the question.
Can I make one comment, Jess?
Yes. Yes,
Daniel, one comment from me. So I know this is very now highly discussed, with these carbonated beverages and potential teeth decay. But when I grew up back in Germany, I would say 95% of all water beverages were carbonated, and only with carbonic acid. And I don't know exactly the concentration, but yeah, I don't think that there was a significant higher or incidence of teeth decay to other countries. So I think it also depends how they carbonated and the concentration. So I think that's also can have an impact on this teeth decay. Next question from Timothy Mahoney: Are diet soft drinks really healthier?
Are diet soft drinks really healthier? Was that the question?
Yep. Are diet soft drinks really healthier? Exactly what he wrote.
Okay. I mean, they have less sugar. I guess the caveat of that is they have artificial sweeteners. If it's usually the diet variety that's no sugar, they're normally sweetened with something else to still make it taste nice. And that's normally, yeah, in the form of artificial sweeteners. Artificial sweeteners are a whole different can of worms, I think. Again, in terms of this project, we've decided to opt for using natural sugars. Again, it's just based off what our partners and the Indigenous Advisory Committee have recommended and suggested, where, yeah, we're fully led by them. But again, like when we're working with Indigenous communities, if they would prefer to have that in there, again, there's the potential that that can happen. I think from a dietetics perspective, artificial sweeteners in general, it's quite a new area, kind of exploring some of the pros and cons of them. So yeah, I would give it another couple years, I reckon, before I form a proper opinion on it myself.
Good, thanks, Jess. So next question is from Bruce Top. There are two questions. Hang on, not one question and a preface. So first of all, I should say, let you know, Jess, thanks for such an interesting and clear presentation. And then Bruce, his question: advertising was low on the list of factors influencing consumption. Why do you think advertising has such a small impact compared to other factors?
I think looking at that graph, I wouldn't say it has a small impact. I think that anything that kind of made it onto that graph means that it definitely does have an impact on soft drink consumption. Why it's less than others. I think lots of papers that we included in that literature review, having advertising was kind of like an on the side sort of thing. I know in urban areas, where bombarded with advertisements and things like that on, social media and TVs, etc. But that literature review was specifically focused on remote Indigenous communities. And so some of the key forms of advertising would be through things like posters, as opposed to, ads and social medias and all of that sort of stuff. So perhaps there's a difference there. And perhaps if we were looking at more urban areas, maybe that would have been higher. But yeah, that's an interesting point.
Next question, Jess, from Colette. Is there any consideration of using non-caloric sweeteners?
Yeah, I think that maybe I almost answered that a little bit in my response to one of the other questions. Again, it's not something that we have initially decided to do based on Indigenous Advisory Committee and Indigenous Partner and their input into it. But again, when we're working with specific communities, if that's something that they're particularly interested in or wanting to try, yeah, as far as I'm aware, it can definitely go down that path.
Mm. Then a very complex, a long question from Co. Starting their ventures with these, they can invest, manage, ownership. They can invest, manage, ownership circle expansion model will break unnecessary barriers of participation in science and public health and livelihood diversified. How do you think? Maybe it's starting their venture with the drink, I guess this product, they can invest, manage, ownership circle expansion model will break. And maybe Co, can you rephrase your question? I mean, maybe that's easier, or maybe or break it in or split it in two. It's a bit difficult, yeah, at the moment to understand what you mean. Then it's maybe easier to answer. Still, that would be great, Co. Maybe in the meantime, oh yeah. Okay, new question or comment from Co. Right, let them make new drink. So you.
Sorry, what was that?
What do you mean, Co, with that? To encourage them to make own, or maybe, sorry, Co, but maybe you can, yeah, or maybe you can look, Co, you can always ask Jess after the seminar, just send her email directly, and that's fine. And maybe, you know, you can discuss this outside the seminar. That's fine. Thanks, Co. Jess, I have an, hang on, that's, yeah. I have a also question. So, I mean, you which I think is great. You presented I think the complexity of your whole PhD in the different, you know, parts or areas, like, you know, what you said, the lab work was very challenging because it was not so your background and all the other aspects. So when you look at the moment, I mean, you are just not even half through, but when you think about what was so far the most challenging part or task, you know, of your PhD, maybe at the beginning you had a complete different, you know, thoughts, you know, how it will work or how you can conduct this, you know, can you, maybe that would be interesting, let us know what so far?
Yeah. There's two things I'll talk about. The first one is kind of relating to what you were saying, working in the lab. So I hadn't been in a lab since like undergrad biochem studies where, we did like 2 or 3 hour experiments and I thought it was the worst thing in the world. And now I have been doing stuff like fibre analysis, which takes like a whole week pretty much to do. So it's been a very steep learning curve, not only getting back into the lab and trying to refamiliarize myself and relearn all of the rules and what bins everything go to and make sure you're doing all the proper PPE. Maybe this is very normal for most people that are listening, but it's very out of my comfort zone for me. So yeah, every time I was in the lab, it was a very stressful situation and a very stressful couple of weeks when I was there. And then not only even that part, when the experiment was done, then doing the data analysis part and all of the calculations. Again, I was really lucky to have An help me a lot with vitamin C and to have Suki and An and Adiyamo help me with fiber and TPC for that, because there's no way I would have been able to do that by myself. But I've definitely learned a lot. And I think as a dietitian, I think it's quite unique to be doing so much stuff in the lab as well, which is, and I think I enjoy the challenge, I think, but I am looking forward to hopefully having a bit of a break from the lab over the next couple of months. So that's one thing. The other, I guess, challenge for me so far was coming into this project. I just messaged Dr. Olivia Wright and just kind of said, you know, what PhD projects are going around at this point. And she mentioned this, and I didn't have an interest per se in the area, or I didn't even know much about Indigenous health or anything at all, and all the intricacies and complexities in working in the field of Indigenous health. And so, yeah, obviously all of last year was, again, like another huge learning curve of trying to immerse myself as much as I can into learning about all of that, because it's such a complex space to work in. And prior to last year, I had no insight or no general knowledge really even about that area whatsoever. But the more I learn about it and the more people I talk about it, the more strongly I feel and the more passionate I become about the project. So yeah, I imagine that will continue to grow. And I know I've still got so much to learn in this space with regards to, you know, wording of specific things and phrasing of specific things, and yeah, being sort of culturally competent. So yeah, I'm looking forward to continue learning through that. But yeah, it's been a journey, and something that, again, I didn't think that I would enjoy working in this space as much as I do. So yeah.
No, great. And also don't forget the ethics.
Oh
That's
yeah,
also a big challenge. I forgot this. Yeah, no, that's something maybe you didn't, or you know, Jessica didn't mention. And you know, for all, you know, these surveys, or if you do anything with you know, with volunteers, you know, you have to, you know, submit an application to the UQ ethics committee. There are different ethic committees, you know, depending on the design and the kind of study, and that could be also very challenging, you know, and it's a lot of paperwork, and you know, it's like, you know, submitting a manuscript to a journal, you get it back, you know, feedback, and you have to answer. Then, you know, there are a lot of questions. So that's also something which can be very time consuming, and I wouldn't say nerve-wracking, but I mean, it's very important, really. It is important to have a proper, for sure, ethics in place and application. But that's also something, you know, which is also, I think Jessica didn't mention, I can't remember, didn't mention it in the slides, but that's also a really time-consuming task. If, hang on, I'm just checking. No other questions in the Q&A box. So yeah, again, I think that's you know, the end of today's last few slides. Yes. Do we have you? Oh, sorry. Thanks, Megan. So just to let you know, Megan is behind the scenes, and she's doing really a great job, technical, and introduced us, you know, this morning in the run sheet. So that's, I think she's behind the UQ logo. So that's really Megan. So thanks very much, Megan. I got some advice. So yeah, the next Quaffy I had this on my page anyway, but the next Quaffy seminar, the science seminar, is next week, next Tuesday, 27th. Please check the website, you know, for further updates and the topics, or you can also ask if you have any specific questions, the coordinator, Associate Professor Craig Hardener, if there's something special you want to know. And yeah, so for today, again, you know, I think would say, yeah, thank you very much for zooming in. I know it's really a busy time, and it's really appreciate and your interest. And if you have any further questions or want to know something specific, just contact Jessica, you know, by email, and I'm sure she's happy to answer your questions. And otherwise, you know, I would say have a great Tuesday, and you know, see you the next week. Thanks. Bye.